Hi guys, thank you for joining. This is Essence of Medicine, and today we are talking about the carnivore diet, and we have a special guest, Dr. Fanel. I'm Amanda Armagost.
I'm Dr. Abbasi for Essence, and our special guest,
Dr. Colin Fanel. Hi.
Well, I remember you went on that carnivore diet about 1.5 years ago?
13 months now.
13 months now.
Yeah.
Now, I can imagine any kind of diet is a difficult thing to do. First, talk about us, how did you decide to go on that diet? And you're a physician, you're well informed about the consequence of any kind of diet and so on. But as well, I want to know, what were your goals on that diet? What have you tried before? Give us a little background about this.
Well, let's back up quite a ways here. So firstly, my medical background is I was a family doctor first, and then eventually became an orthopedic surgeon. I've been practicing as a surgeon now for the last 35 years. And while I was in college, I was a university level basketball player. And I remember at one point in my life, I had a 4% body fat as I was competitive in sport. But life goes on, and, the old 50s come along, and you start, that gaining 1 or 2 pounds a year, every year goes on. And pretty soon I looked at myself, and I was 6 foot, and instead of being 6'3" and 220 pounds like I was when I was in college, and now I was 6'3" and 285 pounds. So quite a different physique, and not by any doing in things that I was thinking I was doing inappropriately, because I always assumed that I was eating well because I had a good mix of vegetables and fruits and meats, and I don't drink. And so I was doing all the things that I thought were nutritionally appropriate. But here I was continually getting heavier and heavier and heavier. Mm-hmm. I have to admit that I wasn't doing a lot of exercise because I had bad hip arthritis, and that kind of shut down me doing a lot of things. But there I was getting bigger and bigger and bigger. And I would go get my blood tests done each year, my annual physical. And the one thing that was standing out that was my triglyceride levels were quite high, to the point where my internal medicine doctor was talking about putting me on some triglycerides. And I said, well, I did some research, and I found out a few things about how our body metabolizes fats. And there was the question about cholesterol, and that's certainly the one that everybody gets excited about. Mm-hmm. And my cholesterol levels were a little bit high. And
it has been a controversy regarding the cholesterol, because we thought one of them is good, one of them is bad. Yeah. And then they went back and forth and so on.
Yeah. And that controversy has persisted for quite a long time, but there's a very interesting evolution of how that developed. So my cholesterols were higher, but not crazy high. But I also had been around medicine long enough to understand that some of these medications, like the statins, they do cause some complications and problems with people on long term. And they're not the perfect solution for trying to balance our metabolism. Somewhere along the line, I saw a online video of a doctor talking about reducing the triglyceride levels, and basically said, well, you have to reduce the carbohydrate load in the body. And some people really need to go to the point where they eliminate all their carbohydrates to accomplish that.
So by consider the so-called Atkins diet from Dr. Atkins.
Well, Atkins or keto, but both of those did include carbohydrates in them. So it was much more protein-based and fat-based, but they still allowed for carbohydrates. But the more extreme version of it is one where all the carbohydrates are gone. So it's all the fruits, all the vegetables, all the breads, all the oils, all that goes out of your diet. And I said to myself, well, is there a diet that I could go on that I'm going to be able to manipulate my triglycerides? Because that has been shown to be one of the things that really does influence heart disease and strokes and things like that. So I said, well, if I'm going to live through this life any longer or healthier, I got to do something, and I don't want to be this fat anymore. So I did some online looking around and ran into a video by a Dr. Baker, who, by coincidence, an orthopedic surgeon like me, a little bit younger than me, and he had been on this thing that he had nicknamed the carnivore diet, and he'd been on it for about 7 or 8 years. Very healthy, very fit gentleman. I've never met him, but listened to what he had to say. And I said, well, this kind of matches up with my one desire of really reducing my carbohydrate load. Let's see what happens. So I recruited my internal medicine doctor and said, we're going to start an experiment with meat. This diet's out there. There's a lot of people doing it, but there's a lot of kickback from the medicine side.
Mm-hmm.
I'm gonna be my own one-man experiment.
What are those kickbacks? What are
Well,
those critics?
Well, just the same. I mean, we've all been taught that we need fiber. We've all been taught that we have to have a well-balanced diet with all these fruits and vegetables to get the appropriate nutrition. And in fact, that's probably not true.
Yeah, I'm just thinking about the food pyramid, because
Yeah.
what's on the bottom of the food pyramid? Isn't it grains?
Grains, yeah. So to make a long story short, I recruited my internal medicine doctor. We did a whole series of in-depth laboratory tests looking at inflammatory markers, liver function, kidney function, all the blood markers, all the fat markers in the body. And so we had the baselines. And then I started the diet in January 1st of 2024. And it's now the end of January of 2025. And I've been doing it for 13 months. Well, within 3 months, my triglyceride level, which had been very high, was down to the low end of normal. My internal medicine doctor saw that rapid transition in that marker and was absolutely blown away, because he said, well, there's no medication I could put you on that would ever change it this rapidly and get it this successfully down. So we continued to do very in-depth blood tests every 3 months. And not only did that continue, but all the other markers, the insulin levels, the glucose levels, the cholesterol levels, the ratios in the levels, all the liver markers all went back to normal. The kidney function all went back to normal. So every metabolic aspect of my body improved by changing the diet, by changing what I was eating. And that all happened very rapidly, along with the fact that when your body is not being getting carbohydrates into it, you have to use other energy sources. And the energy source your body says that it's going to need it takes the fat that's been stored in your body. Mm-hmm. So we talk about, there's sort of the fat you can see protruding, but there's also the visceral fat, the fat that surrounds all your organs internally. Well, that's the first part that melts away. And I was losing essentially half a pound a day in the first month.
That's a lot.
It was amazing. And it's not like I was going to the gym. I wasn't doing anything different. And what made the diet very easy to accommodate was the fact that it's all proteins and fats. You have to have fat because that brings in the nutrients. There's so many of the vitamins that we need are embedded in the fat.
EDKA.
Exactly. And
fat soluble
vitamins. Yeah. And but what most people don't know is that the other ones, the C's and B's, live in the meat. And when you don't have a lot of carbohydrate, your need for something like vitamin C drops dramatically. You need the vitamin C to cope with the carbohydrates. So if they're not there, you actually can get all the nutrient you need out of meat and fat.
Yeah, vegetarians have a really hard time getting their B12s, B6s because
iron.
Yeah, but the B's I think are pretty much only found in animal products or in nutritional yeast.
Yeah. So from that perspective, from a nutritional perspective, we know that there's proteins we need. We know that there's essential fats that we need. But most people don't understand that there are no essential carbohydrates. We don't need any of them for our bodies to thrive. So for my own journey with this was I went onto this diet. It's not a hardship to go home at night and say, I'm going to have a steak that's seared in butter. And that becomes your dinner because it smells good. It tastes great. And it's very filling. A few things happened along the way with the diet. One is that because you're eating such nutrient dense food, you don't eat as often. The desire to snack goes away. So all of the things that make people break their diets.
What would you even snack? Like beef jerky?
Beef jerky, pork rinds, and there's other things you can create. I now make carnivore ice cream.
Oh, what is that? What do you make?
Well, you make it out of egg yolks and cream.
Interesting.
And you can add a little flavoring like some vanilla or some chocolate powder, but the texture is the same as ice cream, but you lose some of the sweetness.
Yeah. Wow. Interesting.
So let's go scientifically about that. This is what we know. Your brain needs certain amount of glucose.
Yeah.
But it can rebuild that from amino acids.
Yeah.
And that requirement can go down with the time that you need, how much glucose you need. And this is actually the fact that your body will automatically take the protein, make that amount of glucose. Even if you're on keto diet, even your metabolism has turned into ketoacidosis, that amount of glucose is truly vital and necessary for your brain. There are good examples that really big people, they go on a really horrible diet or starvation, some modus and so on, and they die. Still, they are big, but they have run out of their own muscles to turn them into glucose. Right. And then when they do the autopsy, they have no muscle left anymore, right. And they don't have enough muscle to breathe. That's how I.
And so, what's fascinating about this diet is, of course, is you're providing enormous amounts of protein.
Yes.
So you don't get that kind of muscle wasting as a diet.
Mm-hmm.
Which also, sorry, I wanted to bring this up right away. We have been referring to it as a diet, but Dr. Fanel and I had this conversation this morning. It's really not a diet.
It's a lifestyle change.
Yeah, it's a lifestyle change. It's not something that you can say, okay, I'm going to go on this diet for 3 months and then lose all this weight.
You're not hungry. That's what you told me.
Yeah.
Well, no, it's not. What I'm saying is it's not a diet, because you can't just go for 3 months on a carnivore diet and then go back to your normal lifestyle. You will damage your body.
Mm-hmm.
Well, damage maybe is a strong term. Your body will readapt back to what you convert
and you're
back
going
to.
to gain all that weight back.
And you probably will gain all your weight back.
And then some.
Yeah. So, but when it comes to something like Ozempic or one of these new medications that people are taking for weight loss, yes, they do make you lose weight, but unfortunately, about a third of that is protein loss, and that part never recovers when you stop the medication. So, people they're muscularly become less and less efficient. This diet doesn't allow that to happen.
Why is that? Why is that on Ozempic people lose? Do we know it?
That I don't think we know the answer.
When people are on Ozempic, they eat less in general. They're less hungry.
Yeah.
So it's not that they're.
But they can consciously eat more meat. Right. If you know what the reason is.
But it does disrupt the protein metabolism in some fashion that I'll fully admit I do not understand. Mm-hmm. So personally, some of the side benefits, certainly everybody looks at this as in a weight loss fashion, but there's other things that take place when you go on this diet. First one for me was I had sleep apnea to the point I had to have a BiPAP machine, not even a CPAP machine, because my breathing was so restricted at night. Well, within 2 months, I stopped snoring, and my BiPAP machine is now just parked on the shelf. I don't need it at all. I don't make any more noise at night, and now I'm sleeping much more thoroughly, about 6 or 7 hours a night, whereas before, getting a couple hours uninterrupted sleep was unheard of. So I'm sleeping better, metabolically I'm better, and I've lost 50 pounds in 13 months. So
there are lots of scientists, nutritional scientists, as we discussed, they say that is a bad diet and so on, and they come with lots of different reasons why that's a bad diet. But there is a group of people, and I want to know if you know who they are. They have been for generations, for thousands of years. They have been exactly on that kind of diet. Do you know what they are?
Well, it started with an evaluation of the native Eskimos of the North.
Inuits,
and one of my first questions a long time ago was, why don't they get scurvy? Because
not only that, why don't they get lots of different nutritional
deficiencies? Well, the Brits came, they started sailing the oceans, and they actually got the nickname limeys because they all thought they had to have these limes to get the vitamin C so that they didn't get scurvy. And I'm going, well, these natives up in the north don't have any fruit trees. They're not, they might have a few berries in the summer, but that's about it. And most of their life is spent eating whale blubber and seal meat and things like that, caribou meat. So they're almost entirely on a protein fat diet, and were for years.
There are carnivore diets.
So about 1910, I can't remember the name of the doctor, but he went up there and was living there for about a year and a half, and ended up being on that diet, and came back in better health than he had been when he left. And then he was back in the New England area and was doing research on exactly this over 100 years ago, and came to the conclusion that it was entirely possible to maintain all your nutritional balance on this.
Do you know what happened though? There have been generation after generation, thousands of years living on that kind of nutrition. I'm not going to call it a diet. And then the U.S. government, sometimes in 1930s and 40s, when they needed to Alaska against the military and so on, they thought they were going to do something good. They built up this literally like a commissaries, and they started giving them the other foods like canned food and grain and so on. And then we see that all of a sudden now when we in our imagination, when we see us Eskimo or Inuit, we see they're short, they're overweight and so on.
Yeah.
This is all us coming and disrupting their natural kind of lifestyle and introducing to a, now they are not really carnivore anymore. They are using other things that all of a sudden they have to deal with the problems of.
They're throwing off their body's equilibrium because their body is pretty much expecting certain things, and now it's receiving something that it doesn't really know how to deal with.
And contrary to you, their body is optimized for that.
So the deeper I've gone into this as time has gone on, the term microbiome has certainly come to the forefront. And my understanding of it is essentially in our gut, we have two not competing but types of cells that are responsible for our digestion. There's the bacteria that are producing things that digest the meat fats, and then there's the bacteria that digest the carbohydrates. And the ones that digest the carbohydrates unfortunately send out a whole series of other chemicals that can then cause other problems in the body. So as I've dug into this, a recurring theme that you see from people who've been on the diet for months, years, is that a number of medical conditions get better. And the unifying theme between them all is these are medical conditions we have a name for. We often have some sort of treatment for, but we have no explanation of the underlying cause. And they're quite widespread as far as the types of things that cause problems. Glaucoma is one. Alzheimer's disease, another. Alzheimer's disease now being called type 3 diabetes. Okay? Psoriasis, rheumatoid arthritis.
Lots of autoimmune disease.
Right. So these things that we classify as autoimmune disease. Now, about 3 months ago, there was a study published, and it was looking at patients with Crohn's disease. And they had 10 men. All of them had had Crohn's disease for over 20 years. And
Can you describe what Crohn's disease is?
Crohn's disease is an inflammation of the gut that causes problems with chronic diarrhea and bleeding, and can be erosive to the point where the gut wall can actually be destroyed.
You can't even eat strawberries because, like, if you eat little seeds, they can get stuck in there.
So on the molecular level, our gut is made of lots of folds of cells. In Crohn's disease, practically what we best of our understanding, our immune system attack those foldings, and our guts become smoother because all those cells go away, and that practically erodes the outer surface, or what I would call inner surface of our GI tract, and then all the juices attack it more, and then literally they punch a hole in our GI tract.
And there's a complementary disorder called ulcerative colitis, where again you get these ulcers developing in the colon. So these things we've known about for decades. We keep coming up with new medications to treat them, and you see the commercials on.
Most of them are immune suppressive medication, correct?
Exactly, and so they can cause other medical complications from taking these medications. But that's what's out there, and that's the standard of care. Well, all of these 10 patients had been receiving those levels of standard of care, and they all had this medical condition for more than 20 years, some of them as much as 30. They all went on the carnivore diet. Within 3 months, all 10 were asymptomatic. 8 of the 10 had stopped all their medication. One of them had had a repeat colonoscopy, and their gut had completely healed. So within 3 months of changing their diet, they were able to change a lifelong chronic condition.
Wow.
So it's been fascinating for me as a surgeon when I see patients with all kinds of medical conditions. They're overweight, which is causing problems with arthritis. I see patients with inflammatory changes. They come into my office. They say, my hands are all swollen. And then they can produce things like carpal tunnel syndrome. They have joints that are all swollen and stiff. So what's becoming fascinating for me is that now I'm spending a hugely more larger portion of my time with my patients discussing the fact that whatever it is they've been doing, how they've been getting treated, hasn't worked for them. That there are alternatives, and a lot of it keeps going back to the fact that it's based on what we eat, and then it's what we eat is then affected by what goes on in our gut, and what goes on in our gut then transforms what happens in our bodies.
And there is a good understanding, and this is not long ago that we recognized the fat, just the fat in our body, is not just fat. It's part of your immune system.
Yeah.
There are lots of immune factors are there. And as a matter of fact, it's actually an endocrine organ. The fat is an endocrine organ. It produces more maybe unfavorable hormones in your body. It actually stores lots of immune cells and so on. So it is the interconnection between the microbiome, the fat in our body, and our GI tract. This is a fantastic area of the science that we just start to really understand more and more.
So, from my personal experience of going down on this journey, is certainly I've lost weight. I turned 69 this coming summer. At this stage of my life, I am on no prescription medications, and I take a couple of supplements. And for those,
may I ask what those supplements are?
I was just going to say vitamin D,
Mm-hmm.
and vitamin D. I've learned since COVID, we've always underdosed it. It's kind of an interesting product all
What
by
do
itself.
they say? 5,000 units?
Well, the Surgeon General of the United States, when they put out the report about 10 years ago, was only recommending 800 units.
Oh,
And
okay,
so
even lower.
yeah. So, but no, I don't agree with that number at all. The longer I'm in the game, I don't agree with that. The one of the cute things in the world is what is an international unit of vitamin D, and the international unit of vitamin D, 1 unit was how much vitamin D did it take to stop a 30-gram mouse from getting rickets. And then we just extrapolated from that little animal to the human body and said, well, we need about this much. So the vitamin D recommendations historically have all been, how much does it stop from getting an adult to stop getting rickets? Well, that's actually pretty easy to do. But we've learned subsequently that vitamin D is way more involved in our immune system, but it needs a much higher dosing to be able to activate the things that it triggers. So personally, I'm taking about 10,000 units a day.
Okay.
Now, many people would say that's much too much. A Canadian study was done a couple of years ago when they looked, and they started at 20,000 units and couldn't produce any evidence of toxicity. So 10,000 units is, for a person my size, is very acceptable. I monitor my vitamin D levels, and they're all at a level that are exactly where I want them to be.
But I want everybody to know, if you're going to do anything of this kind, certainly, connect to your doctor.
Yeah.
Because, there are other conditions that can be involved in the management of the
Sure.
vitamin D metabolism. So don't just go and do things on your own. Connect to somebody who's professional.
Right.
Yeah, and we're all humans, so every body is very different.
And
So
that's
always monitor yourself.
Yeah, there isn't a specific dose for vitamin D. It's body size, and it's what the challenges of your immune system are confronted with, because it's consumed as you fight infections. If the flu's in the area, your vitamin D level and requirements are higher. It's based on the time of year, how much sun exposure do you have. So I think ideally the way it should be managed, and I see people all the time with issues of osteoporosis, they've got vitamin D deficiency. You need to get them back on a dose that's going to get the tank full. You need to monitor it again to see how much does it take to keep them full, and then kind of over a period of 1 or 2 years, you can get an idea for that person and their activities in this location, because it matters if you're in Florida versus if you're in North Dakota.
Okay, Do you want to talk about that actually what it is, that's why somebody in northern Minnesota need more vitamin D than somebody in Texas?
Well, first step is skin color. Dark people block the ultraviolet rays that don't produce as much vitamin D. So dark people, particularly in the northern part of the United States, are going to have a distinctly different issue with vitamin D in their body, and will very frequently will be vitamin D deficient. Light-skinned people will absorb it better, but many of the light-skinned people historically have all lived in northern climates, and guess what happens in the north in the winter? Sun goes down. They got jackets on and clothes on, and their skin exposure is next to none.
We have a precursor of vitamin D that literally in our skin with the certain ultraviolet rays, it just change the configuration, and our body can change it into the final product, the vitamin D that our body needs. And obviously, it is absolutely true that depending on your skin of your color, it regulates how much. As a matter of fact, your skin color directly correlates with the amount of the
melanin.
The melanin is the skin color. It correlates exactly with the amount of the ultraviolet rays you get. Not sun, ultraviolet rays. Like lots of people in Himalaya, and they're darker because they get up high lots of ultraviolet rays. And as well, if you go in Africa, if you look at the height, the altitude, and the north-south, you see that skin color change. The darkest people are in Senegal, in tropical Africa. If you look at the Americas, you notice that it correlates, but not as much in Africa. And the reason for that, the scientists have found, is because by the time about 60, 40, 50,000 years ago, people came from Siberia to America and spread out, they already have clothing. So the exact, just the rays amount of the ultraviolet, they wouldn't correspond with that. But either way, that regulates how much vitamin you get, but as well regulates how much damage you get. So in the nature, for every climate, for every level of the ultraviolet rays, you are more or less optimized. Now, we have the problem, people are born in one place, that they can go from one place to any other place with a different situation. Now, biology cannot adjust so fast to those changes.
Right. So vitamin D, and specifically vitamin D3, is one of the supplements I take. Now, vitamin D3, I'm an orthopedic surgeon. We're all about bones and vitamin D, and everybody's heard about calcium. So yes, it's involved in helping with bone construction. But interestingly, vitamin D's principal job is to teach the gut to allow the vitamin D into the blood system. But once it gets there, it's not very clever about where to go. There is a second vitamin that most people have never heard of, and it's called vitamin K2. And there's a series of vitamin K2s, I think up to 8 different variants of them. But there's 2 of those variants that are the ones responsible for deposition of calcium in the body. So when you get enough vitamin K2, it will tell the calcium your body absorbs to go to the bone. If you're deficient in vitamin K2, it will deposit where it wishes, and it often just chooses to deposit into the arteries.
So it's harmony between these different vitamins.
Yeah. So people who have sufficient vitamin K2 have vessels that are more pliable, so the pressures don't expand. They don't get the hardening of the arteries. And vitamin K2 at a sufficient dose is actually capable of extracting calcium from hardened arteries and putting it back in the bone where it belongs. So I now tell all my patients, if you're going to get on vitamin D to get calcium and a calcium supplement to get things into your body for osteoporosis, you have to take this other vitamin to make it work.
What is
K2?
K2.
What is it found in?
Well, naturally is found in in the organ meats. Okay, so it was in
Not for you.
liver and kidneys and things like that. But most people aren't eating those kind of things. So almost universally, people are vitamin K2 deficient.
So K2, because when I hear K, I hear leafy greens.
Leafy greens, and
greens.
if you say vitamin K to a doctor, they're going to talk about blood coagulation, because that's very much involved with all that. But this is a very different animal.
But K2 is not found in leafy greens?
No, not to that extent. Okay. You can find it in yogurts. So Greek yogurt will have it. Some of the hardened cheeses, like Edam cheese, will have it.
Is that because a lot of the cheeses have those stomach enzymes?
Yeah, exactly. So it's in some of our foods, but if the most concentrated version was in the organ meats. Mm-hmm. So I tell people to take that. So I take vitamin D3, and I take how much? I take 10,000 a day. Vitamin K2, I take 100 units of that a day.
That is such an interesting thing. There is an old documentary about the Inuits, and one of their traditional ceremonial thing is when they get a seal, one of the first things they do, they take the liver out raw, and then they split it in equal pieces. And everybody in their community has to have a piece of that. It makes now so much sense that, that is the first thing they do. They don't cook it, so everything is still there. And they literally cut it in stripes on the ice, and right there. And that's the first thing they do actually, that's like a ceremonial.
It's actually interesting that you say that too, because haven't you also said in the past that the first thing that animals eat is the liver? And I think animals are
watch them in any of the YouTube videos.
And animals are much more in tune with their body and their bodily needs than humans.
Well, there's a lot of great white sharks not very happy with being made unalive by the orcas in the world now, because the orcas have learned to eat the livers off these great whites. So
move on.
And then don't they just leave the body
too? Just leave the rest. They take the livers out and away they go.
So I wonder if the animals are understanding that they need the But like obviously not that
somehow
way, but
somehow nature has taught them that's the most nutrient dense part of
yeah.
it. So
Yeah, but
Interesting.
that's interesting though. Most of Caucasian people, like in my culture, liver is the best you can have. As a matter of fact, when we want to just catcall a woman, we call her liver in my culture because it's very, no, seriously.
Yeah, but then in my culture, an insult is like, "What am I, chopped liver?" Right?
See, in my culture, liver is the delicacy. I mean, oh my God, you get it out and you eat it right there, barely, just, like you put it barely on fire and so on. Whereas in most of Western culture, yucky,
Yeah.
liver,
Yeah.
and so on.
So the only other supplement I take is in the carnivore diet, and we haven't really explained what that means. Okay, so it's a meat, protein, and fat diet. Now the meats can be any animal that you would think from the farm, so lamb, beef, chicken, turkey, you name
Wild game.
it. All the wild games would be perfect. And then on top of that, fish. And then there's some variance in the theme. The more strict carnivores, they're just keeping it to those kind of things. But some people, if they're not lactose intolerant, are adding dairy, so creams and butter. And then most carnivores will add eggs into the diet.
Do you add eggs?
Yes, I do. I now have a source of farm fresh eggs, so I'm eating probably 18
By the
eggs.
way, have you noticed how expensive eggs are?
Well, I'm lucky with the farm fresh ones I'm getting because they're still.
But I'm gonna as a chicken girl.
Yeah.
It's expensive.
They're expensive, but I'm not. I do go fishing about once every 2 years for salmon, so there's usually some in the freezer, but I don't eat it as regularly as I eat other things. So I do take a omega-3 supplement. That's pretty important in the system. So we're learning so much more about the metabolism of fats in the body. There is a group called the cholesterol code that's doing research on fat metabolism, and they're basically rewriting the textbook. All the things we got taught when I went to medical school and even before that in the 50s and 60s, we're finding out that what has been presumed to be correct was wrong, that there are many more elements to this. How does the body keep cholesterol, and what is it for, and how is it healthy for us?
Yeah.
And so the standards that have been set for high cholesterol, low cholesterol are probably inappropriate. The Denmark came out with a study last year, and they looked at 50,000 people they followed for 10 years and measured their cholesterols and how they affected lifetime mortality. And what they found is that if there was multiple medical conditions and the cholesterol levels were high, and I'm talking like in the 250, 300 range, yes, if they brought them down, they started to improve the mortality of people. But it created a U-shaped curve, and the bottom of the U-shaped curve came down to about 130 to 140 on the cholesterol levels. But we're still being taught that the cholesterol has to be pushed down under 100. So people are being put on medications to get it even lower. Well, what that did was it now puts them onto the backside of that curve that starts to go back up again. And so the sweet spot for the cholesterol levels was about 130 to 180. And to this day, all of our physicians are being taught that if you want to lower it, lower than that. But the Danes showed that after a decade, when you got lower, you actually started increasing mortality of patients again.
Yeah,
So,
I remember hearing some theories about lobbying and in the cholesterol industry.
So this group from the cholesterol code, they've come up with a subtype of people. They call them the lean mass hyperresponders. And these individuals are typically very fit, very athletic, very thin, and have cholesterol levels in the 300, 400 levels.
And that's why medicine is not exact science. Right. Something that if you wouldn't do it would be malpractice. Just 2 decades later, if you do it, it's malpractice. Yeah. So, and this is two extreme things, same thing.
Yeah. So this particular group, this cholesterol code group, one of the members of this group is a PhD, but he's now at Harvard Medical School, and he's becoming a physician as well. But he is one of these people they call a lean mass hyperresponder. And so he has a very high cholesterol level naturally in the 300 and some level. But in their new theory of how cholesterol is metabolized and how it's functioning, they said, okay, well, we don't think this is causing a problem for you as an individual, this particular doctor. But based on our theory, if we were now to interject a small amount of carbohydrate into your diet instead of you being on a complete carnivore diet, we should be able to push your cholesterol level down. So they decided to put this concept into a little bit of tongue in cheek as far as the research. And so his job was to eat one sleeve of Oreo cookies a day to go along with his carnivore diet.
One what?
Sleeve. So half a package of Oreo cookies.
It's called one sleeve, one row.
Yeah, one row of the cookies.
Yeah, that's called one sleeve.
Yeah, so that was his diet change. Was he started eating Oreo cookies, and they then measured his cholesterol every day, and I believe it was within 10, maybe it was 14 days. His cholesterol went from the 300s down into about 120. So they said, well, that follows their theory about how cholesterol is metabolized and the impact that these things have on the body. So now we're going to take away the cookies and we're going to measure them every day and see what happens. Within a week, he was back up into the 300s. So then they put him on one of the brand name statins and said, okay, we're going to measure your statin cholesterols and see what the statin does to bring your cholesterol down. Well, he was on it for 8 months and it moved 30 points. So within 2 weeks, he was able to produce the change that everybody thought the standard medicine said he needed by just eating cookies. But when it came to the drug took 8 months and still hardly made a dent in it. Yeah. Now they didn't come out of it saying, "Oh, everybody take Oreo cookies to solve your cholesterol problems."
They should sell Oreo cookies in that pharmacy.
Yeah, but so they didn't come out of it saying that.
She would like that.
They said this is obviously not a healthy thing to do, but they did. But it helped to confirm their new concept of how cholesterol is being metabolized in the body. And they weren't so certain that this was really that specific subtype of people. They think this may is actually being more generalized. So on a personal note, I have been getting my cholesterol levels measured, and the LDL cholesterol was still running kind of high. So I told my internal medicine doctor, okay, we're going to make a change starting on July 1st. And I'm going to have every day, I'm going to have a handful of either blueberries or grapes.
Typical surgeon telling the internal medicine what we are going to do.
So, but we made that one adjustment in my diet 6 months after I started it. And then we measured, so we did labs on July 1st, and we repeated them at the end of October. And lo and behold, my cholesterol levels dropped about 50 points. And he just said, so now that my triglycerides are down, my cholesterol levels were down, and he just was absolutely taken aback by the fact that with simple dietary manipulation, I was able to accomplish everything that he had ever wanted to see happen with me based on that, but not using medication.
Even though you and I are on completely different lifestyle paths, literally opposite carnivore vegetarian, we both have the same philosophy that a lot of what's going on in our body can be healed by food and what we're eating. And I think that is starting to pick up a little bit more where people are learning about herbs that are good for you and things like that. But it needs to pick up a lot quicker.
Oh, well, I'm so glad that we got to get Kennedy in, because he's going to have a huge impact on this entire USDA and their food pyramid, which is absolutely wrong.
Yeah, and the dyes.
Yeah, and the dyes and all these additives that are going in there. But there's one other element of this that came out as a result of COVID, and some of the research that was being done there. The University of Boston has been looking at patients with end-stage cancers of the brain. Now, they're difficult to treat. There's a thing called the blood-brain barrier that prevents chemicals from getting across. And so giving chemotherapy has not always been that successful. So they were treating a lot of these patients with radiation treatment. And a lot of people had styles of cancers that weren't amenable to being resected with surgery. So the life expectancy of these high-grade cancer patients was very low. The group that they had was averaging about 6 months after diagnosis.
You're talking about glioblastomas.
Yeah. So one of the thoughts that they had was they've been looking at what feeds cancer cells. And it turns out the glycogen is right up there in that. So they said, well, if we go to a carbohydrate-restricted diet, can we affect how these cancer cells get their food? And so they put these basically people who are dying on this, and lo and behold, within a very short while, they now had patients living 6 to 7 years after diagnosis, but not getting chemotherapy, not getting radiation therapy, but all they changed was their diet. And they were doing frequent PET scans on them, so they were monitoring the cancers. And what they found was that they could actually tell when the patients were cheating from their diet because the cancers would start to grow again. So they've never claimed that they're curing the cancer, but they're saying the cancers won't grow if we restrict the food source. Subsequent to that, they're now looking at the metabolism of virtually every other cancer, and lo and behold, it's almost the same with any other cancer. So colon cancer, breast cancer, lung cancer, all of these things, if you restrict
all of them like glucose, but none of them like fat?
Exactly. Yeah.
Okay.
And so prostate cancer. So all the real common ones that are out there. This is certainly not standard medical care at this moment. If anybody out there thinks they have this issue, you better have a long discussion with your oncologist and with your family doctor, your internal medicine doctor. But there's some interesting research now coming up that potentially we can have a huge impact on the cancers in our body that develop every day and our normal our immune system gets rid of. But for the few people out there that develop these cancers, this may be one way we can help to control it.
Yeah, I've read that same, because I'm really into gut health. I've read the same thing about like sugars and things, these artificial things that are in our diets that are really feeding what's hurting us.
So I am spending an enormous amount more time in my office as an orthopedic surgeon who's, from the medical perspective, I'm one of these guys, boys with their toys, and we cut things, we fix things. But I'm spending way more time now talking about nutrition with my patients.
So we have a few more minutes. Imagine your patients are listening. What do you want them, the essence of what you want them to know? What do you want them to know?
I want them to know that there are a multitude of medical problems that are, I think we're going to learn as the years go by, been self-inflicted. And your body has reacted in a particular way, and there's been issues that have developed, and you're going to run into a medical system that will give it a name. They will often have a treatment for it, but they will rarely give you an underlying insight into what caused it. And
there's always a medication for that thing.
Yeah.
It is. And that medication often is, is not cheap.
And rarely does it cure the problem.
And sometimes medications can cause other problems too.
Almost all of them do.
Definitely.
That just goes with the territory. I have a friend. He was so frightened about his cholesterol because his dad died when he was in his 50s. And his cholesterols were a little bit high. He was afraid that he was going to get heart problems. And so he's been he was treated by a major medical center in Los Angeles. He's now being treated in a major medical center in the Midwest. And they had him on the fairly high doses of statins. And he's just turned 70. He's a professor, teaches. And the side effect of the statin was to the point where it was causing neurologic problems, and to the point this man who's otherwise fit, and he and I used to jog on the beach, he could no longer even drive his car.
Wow.
So we got him to get off of the statin at much reluctance, because after 2 decades of being told this was what was saving his life, he took the statin off, and within 3 months, all of his motor function came back and he can drive again.
Well, considering 25 years ago, it was said everybody should use statin, no matter if you have a problem or not.
Yeah.
Everybody, it's almost like a conspiracy theory.
I remember when I was in 3rd grade, I had a friend who wasn't allowed to eat eggs because her parents said there was too much cholesterol in it.
Yeah.
And she was a child. We're in 3rd grade.
And you need cholesterol, particularly during your developmental years. All of the hormones in the entire body are built off of cholesterol.
Yeah.
And so you deny those to the human body. It actually causes major issues with the development of everything.
Yeah. Well, it's just see our medical knowledge is evolving, but as well you see again that how special interest can sometimes dictate medicine turns, and the policies in medicine.
Well, so my take-home message is that many things that people have been told you can't get rid of this is you for the rest of your life, can be made better. The number of patients who are online now talking about how their psoriasis has gone away completely. There's other medical conditions. Well, even acne gets better. People's dentition gets better. Their teeth, their gums heal. People's vision improves. So there's a multitude of different positive effects.
And nutrition and microbiome are interconnected because they live from each other.
Yeah.
And as well, our knowledge of our microbiome has tremendously improved in the last just 5 years or so. to a point that, there's studies that are proven that this microbiome transplant, you know what that is?
I know what that is.
So, well, I want to tell to our audience.
I want to do a whole podcast on that because I think it's really cool.
Are you saying macro or micro?
Microbiome transplant.
Yeah, so it's poop transplant.
Either end. You can
Yeah,
go
but
either
you know what's
end.
crazy? Sorry, guys. You'll hear all about this probably next week. But if you get a microbiome transplant from someone with acne, you can get acne. And if you can
True.
even get their mental health issues too, but you can get the benefits.
So I'm not going to get any microbiome transplant from you.
No.
If it caused me to have...
I don't have acne.
Yeah. And
And I have really great mental health. You actually could...
you should be a good subject from that. Yeah.
I've been actually considering...
Well, I would say thank you, but I pass.
I've been considering proposing that to you, actually.
Yeah. So I've been more and more impressed by how the diet has a huge impact on people. And I see people at the end stage where things have fallen apart and become destroyed because of the consequence. And there's a few that I'm hoping that if we can convince them to make some sort of change, again, do it with guidance. I've been working with my internal medicine. I keep track of all my laboratories, making sure that I'm not causing any additional
That's
problems.
a good message.
But I've been so impressed by how it's affected me, and I'm convinced that more people would benefit by taking a strong look at what you eat affects how you are.
And well said, and that's a good conclusion.
Yep.
This was a good podcast, and I think even if you're not versed in medicine, if you know nothing about this, that give you a good foundation of how to behave. So thank you very much.
Thanks, Dr. Fanel.
Been a pleasure.
Thank you guys for watching. Have a good weekend. This was Essence of Medicine, and we talked about the carnivore diet. I'm Amanda Armagast.
I'm Dr. Abbasi, and our special guest,
Dr. Colin Fanel.
Thank you.
Thanks, guys.